I have checked the orders, and Mr. Wayne Smith here, I have identified the patient, and the order said that I needed to do a nasogastric tube, and I have also explained the procedure to him that we're going to be doing a nasogastric tube into the right nostril, because that's the nostril that he decided that he wanted to get. And also I've checked his pain level. He doesn't have any pain. He's allergic to aspirin, but not allergic to any latex or any iodine. I have also provided privacy, and I have performed hand hygiene. So now I'm going to go ahead and start the procedure first by getting my equipment that I have right here, as well as measuring the nasogastric tube. First, I'm going to go ahead and place this towel here, as well as a basin, and now I'm going to measure the nasogastric tube, starting from the tip of the nose to the earlobe to the xiphoid process. Right there, and I'm going to mark it at the 47 mark with a piece of tape, and then I'm going to use my lubricant and lube it 2 to 4 inches. And I'm going to give Mr. Smith a glass that he can use to sip some water on when he starts to feel a little discomfort and starts to gag. Okay, are you ready, Mr. Smith?
Okay.
Okay. All right, so I need to lift you up first. So let me raise up the bed. And Mr. Smith is already in the high Fowler's position, which is 45-degree angle as far as his body goes. All right, so Mr. Smith, I'm going to have you take a nice deep breath, and we're going to begin. Okay, put your head back up against your pillow. Here we go, really quick. You're starting to gag. Okay, go ahead and put your chin to your chest a little bit. Good, we're almost there. Wonderful. Okay, I'm at the tape. Now I'm going to temporarily place a piece of tape here. And I'm going to put in 30 cc's of air into the stomach to make sure that I have placed it in the right area. And I can hear the bubbles. It is in the right position, and I'm going to go ahead and aspirate some stomach content so that I can check the pH level. It is green in color, and the pH is at a 1. Okay, so now I'm going to remove my gloves, perform hand hygiene. And what I'm going to do now is use some skin protectant on your nose, right here. And then I'm going to go ahead and tape this to your nose. Like this. Let me remove this tape from the side of your face here. And wrap this around this side, and wrap this around this side, and then do one more piece of tape across the bridge of your nose. There, and then I have already pre-placed a safety pin here that I'm going to be able to secure the tubing. Can I get you to go ahead and turn your head a little bit to your left? Good, thank you. Just to make sure that I place this tubing in the right spot. And I would go ahead and hook the tube up to my suctioning device. Okay, and then I would lower the bed and remove the equipment. check the patient's pain level again and make sure that they were okay, remove all of my equipment, and then wash my hands one more time after getting rid of all of my equipment. And now a couple of days have gone by and it is time to remove the tubing. So again, I have checked the orders, I have identified the patient, I have performed hand hygiene, I have provided privacy, I have explained the procedure to the patient, who is Mr. Smith. I have checked his pain level and made sure that he's not allergic to any allergies, or that he doesn't have any allergies. So I'm going to go ahead and put gloves on again. And raise the bed. And I will be removing or turning off the suctioning device off of the tubing, and I will be putting in a 30 cc's of normal saline to flush out the tubing. And now I'm going to place a towel here. Alright, and then Mr. Smith, as that we have already discussed, I'm going to be removing this tubing from you, okay?
Okay.
Go ahead and unhook this right here. Take off that safety pin. Alright, now you're going to feel me doing a little tugging. I'm going to first pinch off this tubing here. You're going to feel me tug a little bit on your nose just as I'm taking away the tape off of your nose, okay? Please let me know if you're in any discomfort. All right,
Okay.
so are you ready?
Yeah.
Okay, so on the count of 3, I'm going to have you take a nice deep breath, okay? 1, 2, 3. And I have pinched the hose as I'm removing it. Get rid of that. And then I would go ahead and provide you a rag to be able to wipe off your face. And remove my gloves. Wash my hands. Put the bed back down. Assess the patient's pain level again and make sure that they're put in a comfortable position. Put on another pair of gloves. Grab a hold of the fluids that have been draining, the gastric fluids that have been draining from the patient's stomach right here. And I would note the color and the amount and place it into the records of the patient. And then I would wash my hands once more as I am removing all of the equipment from this place. Make sure that I have placed the call light in access for the patient. And I'm done.